This is the sound of refusing to give in. It's leaving nothing to chance. Searching relentlessly for the right, the only treatment option that will keep a heart beating. Fortunately, the Christ Hospital Health Network has groundbreaking treatment options unavailable anywhere else in the country, developed with help from our own physicians. That's what makes us Greater Cincinnati's Heart Hospital and one of the top heart hospitals in the world. The Christ Hospital Health Network, everything it takes.
The Pound This Podcast is brought to you by the Christ Hospital Health Network. This is the Pound This Podcast, episode 822, all about hand health with Dr. Noah Shaftel.
I want to lose weight, but I don't know how to get started.
What should I meal prep every week?
How do I get those sweet booty gains?
Inspiration for your healthy lifestyle. The Pound This Podcast with Amanda Valentine.
Hello, friends. Welcome to the Pound This Podcast. Actually, in this episode, we are answering your questions, listener questions all about hands and wrists with Dr. Noah Shaftel. Before I get into that, though, I want to tell you about Sarah and Team Fit With Me, who has made a difference for so many people, including a lot of Pound This listeners that are looking to reach their goals. But you know what? It's freaking hard to do on your own. So Sarah is an amazing health coach. Helps you keep you accountable, will help you with your nutrition, help you with your exercise, and she will fully customize your plan to your goals and to your budget. So if you're like, oh man, wouldn't it be so awesome to have a coach, but I just can't afford it? Just reach out to Sarah. You can work something out, figure it out, because this is your health. It is super important, right? So I know I have had Sarah as my health coach before, and she helped me with all of my meal plans for the time I was meal prepping for myself, and okay, this is what we're going to make. Here's what your macros are. Here's some suggestions of what to make. Jess, who's on her team, like the macro goddess, will have so many amazing recipes that you can modify. So you're eating like the most delicious foods, but also hitting your goals. So if you're looking for fat loss, if you're looking to get stronger, you're just looking to be healthier, check out Sarah and all of her team. Go to teamfitwithme.com and just reach out and ask some questions and see if Sarah and her team are the right fit for you. If you are in Cincinnati, I would highly recommend going to Clean Eats in Newport, because it makes eating healthy so easy and so convenient. Because you know what? Eating healthy is not convenient. It's not. And if you're not into packing all of your meals and cooking and doing all of that stuff, you want somebody to do it for you. If you're just like, wouldn't it be nice if somebody cooked for me? Hello. Clean Eats in Newport does all of that for you. Whether you go in and there's an entire wall of all of the frozen meals, including big meals for families, frozen pizzas, or just one-off meals. You can buy all of those there. You can do the fresh meals, which is what I do. I do 21 meals a week because you know what? I don't want to have to think about anything else. I want all my meals taken care of. So I order 21 fresh meals a week and I go pick them up on Sunday, and that's all I have to think about. It's absolutely amazing. Also, there's the cafe, so if you can go in and get a power bowl, a salad, flatbreads, melts, all that stuff if you're looking for a healthy place to go to lunch. Clean Eats in Newport is chef's kiss amazing. If you want to take a peek at some of their food, I usually post it in my stories on Instagram. You can follow me at You Can Pound This. But if you're in the Cincinnati area, highly recommend checking out Clean Eats in Newport. Right now, though, let's check out all about your hand health. Thank you so much for listening to the Pound This Podcast. I am Amanda Valentine. Returning guest from the Christ Hospital Health Network is Dr. Noah Shaftel. How are you?
Hi, great. Thanks for having me.
So I have to tell you, we chatted in 2021. It was a couple of years ago. And there's something that you said in our conversation then that I have brought up multiple times over the past couple of years, was that so many hand and wrist issues come from your core.
Yeah, right.
And I was just that kind of blew my mind. And then at the time I was a personal trainer, which I'm not now. But anytime that stuff would come up, I'm like, well, actually, you should work on your core. A doctor told me that.
Fantastic.
So we might have to go into that a little bit too, because that definitely really resonated with me from my last conversation with you. But before we get into a whole list of questions that I got from listeners, tell me a little bit about you, your background, what you do at the Christ Hospital, all that fun stuff.
Yeah, so I grew up here in Cincinnati and left for a long time for training and things like that. And eventually we moved back to town in 2013, and I started working at Christ at that point. And I'm the hand and wrist surgeon at Christ. What we call hand surgery is usually sort of elbows to the fingertips, sort of stuff. But I've been there for about almost 10 years now. And I'm an orthopedist who just specializes in things from the elbow to the fingertips.
That's awesome. So that's what I put. So I just put a question box on social media. I'm like, questions about hands and wrists, all of the above. Tell me what you got. And so the first, like the thing that just kept popping up over and over and over again is people asking grip strength questions. Now it was just in general, like my grip strength. So I don't know if that comes up for you, or is there exercises we can do, or is it just because as we age, we can't hold things for as long, or I guess I'll just throw that broad topic at you and let you take it.
So there's a lot of reasons why people can feel weak in their hands. And it can be something just as simple as disuse, which most people are using their hands on a regular basis enough that, they're getting enough exercise. I always find it amazing when people come into the office and say, well, you don't understand, I use my hands all the time. But that's everybody, right? Yeah. Everybody's using both of their hands. So it's not usually a disuse thing, or that they're not getting enough exercise or doing enough things. But it can be things like nerve issues, like carpal tunnel syndrome or cubital tunnel syndrome, where nerves are pinched and they're not really stimulating the muscles appropriately. And so people can get weak from that sort of stuff. People can have weak grips from arthritis in their hands, which either limits their motion or is painful to do, particularly pain down at the base of their thumbs, which is very, very commonplace to have arthritis in the hand. And those are, in general, those are the two most common reasons for people to have weakness, would be either sort of a nerve issue or some arthritis. There are other things that cause pain, and so people have weakness because it hurts, and things like tendonitis or some localized swelling or things like that can be part of it too. But I think most people think it's because they're not getting enough exercise or exercising their hands. But like I said, for most of us, our daily activities are plenty in terms of keeping the muscles moving and things like that.
So something like that, would it just be helpful to take like some ibuprofen and have like an anti-inflammatory thing to chill it out, or nah?
So when it's usually arthritis driven, anti-inflammatory certainly can be helpful. Those sorts of things can kind of help nerves a little bit, but tend not to be the solution if it truly is a nerve problem. Now, most of the time that weakness comes with numbness or tingling in the hand if it's a nerve issue. Arthritis is usually the more painful thing in the hand. And so things like ibuprofen or Aleve or an anti-inflammatory certainly can be helpful for that kind of stuff.
So how would you know it's arthritis? Would you just kind of self-diagnose that it's like, oh, it feels kind of just stiff and achy?
Yeah, people usually can sort of point to a joint or a specific location and say, boy, it's sore there, or it hurts when I grip there, or I grab something there, or I pinch there. With things like I said, nerve issues and other things like that, it's not usually particularly a pain issue. They just have trouble sort of feeling like they're weak there. So arthritis, if people can identify it or put it to a joint or a couple of joints, that's usually more of an arthritis or joint inflammation issue. If it's sort of more of a vague thing, or like I said, is accompanied by numbness or tingling or things like that, then sometimes that's more of a nerve type issue.
Okay. Well, speaking of that, I do have a lot of numbness and tingly burning questions for you. The next one I have is, what might cause numbness and burning between the thumb and pointer fingers?
So when people have numbness and tingling in the hand, I obviously look at the hand, but there's other things that are important too. So if you think about how nerves start, they start up in our spinal cord, and then they leave the spinal cord and branch out to different nerves throughout our extremities. And all the nerves that go to the hands come out of our spinal cord up in the neck area, we call the cervical area. And so nerves can be pinched or irritated anywhere from up at the neck all the way down to the hand. But that being said, the most common places to have nerve irritation or nerve pinching is carpal tunnel syndrome, which is where one of the nerves in the palm is compressed. And that usually provides sensation to the thumb, the index finger, the middle finger, and half of the ring finger. So when people say, well, it's my thumb and my index finger, that's more of the distribution of the median nerve, which is involved with carpal tunnel syndrome. If people have more numbness or tingling, let's say in their small finger or their ring or small and ring finger, that's more related to cubital tunnel syndrome, which is the ulnar nerve. That's your funny bone at the elbow. And there are times where you can have pinched nerves in other places as well. There's another one called the superficial radial nerve, which provides sensation to sort of the top of the hand and the top of the thumb and index finger. But those are the three main large nerves that provide sensation to the hand. And any of those can be compressed anywhere along the length from the hand up to the neck. So trying to identify the exact area where the nerve is irritated is super important. So just saying that somebody has numbness or tingling in their thumb and index finger doesn't necessarily tell you where along the length of their arm it could be, or if it's in their neck. But that's why it's important to have a good exam for these sorts of things, which usually give you some idea of where the problem's coming from.
So how do things, I mean, I know this is different from every person, but I guess in just general, most cases, like how do these nerves get pinched? Is it you just move the wrong way or you sleep the wrong way sometime and then you're just stuck?
Yeah, for most of these things, nobody really has a good idea of why they happen. That we'd sort of put most of these into the idiopathic category, which just means just sort of happens. There's not a real cause. And people have tried associating causes with all sorts of things over the years. And a lot of it turns out to just be sort of misunderstandings or not really quite clear. So, but most things like carpal tunnel syndrome, they just sort of happen. It's probably some component of genetics and age and activity and luck. There are some instances where people have underlying medical problems that can contribute to it, something like diabetes or thyroid problems. Those oftentimes can have effects on nerves as well. But oftentimes we don't have an exact reason why these things happen or why they develop in one person versus another. But in general, pretty darn common. I mean, most hand surgeons, the most common thing we see in the office is carpal tunnel syndrome. It's not because everybody's working the same job. It's not because everybody has the same activities. It's just one of these things that just sort of happens in us. But most of the time, there's not an obvious reason or cause for it.
Well, speaking of carpal tunnel, I got several questions about that, including when do you need surgery?
Yeah. So that's sort of a tough thing to pin down. So we know that the longer nerves are compressed or the more severely they're compressed, that there's some point at which the nerve is damaged enough that no matter what you do, it's not going to recover. And we never really know when that point is. But the point being that if people continue to have symptoms and they're getting worse and they've been there a long time, surgery is usually a better answer for those folks. If people have had symptoms relatively recently and they're sort of intermittent or they just bother them at night, then sometimes there are other things we can do like bracing or carpal tunnel injections that can be helpful. But we don't like people to have symptoms progressing for long periods of time or very severely, because that's when you start getting into the territory of nerves being irreparably damaged, and even successful surgery that won't necessarily help.
Oh, that's a bummer. Then you just have to live that way the rest of your life, pretty much?
Well, sometimes, yeah. And there's sometimes when people show up, let's say in the office very, very late in that process, and they've been living with it for years and they just never wanted to do anything about it. And there's certainly still reasons that people have surgery, either to try to salvage as much function as possible or try to make things better. But there are absolutely times where, despite a successful surgery, their symptoms just don't get much better.
So what you're saying is go see a doctor whenever you're early on in your symptoms so you don't get to that point.
That's right. Exactly. Exactly.
Somebody did ask, how long does it take to recover from surgery? Because I would imagine, you're getting surgery on your hands. You need your hands, pretty much all the time. That seems pretty rough.
Yeah. We've sort of adjusted how we do things a lot. Just like, folks, let's say, had knee replacement, used to be in the hospital for 3 days and had a much more prolonged recovery. Recovery from carpal tunnel syndrome we've sped it up quite a bit over the years. In fact, we let people go back to light activity in a few days, most desk jobs and things like that. We have people who, go back to heavy activity, usually hold them back for about a month or so, and then let people start going back, so that the days of having to be out of work for 6 weeks and all this kind of stuff has sort of changed. Now, that doesn't mean that people don't still have soreness or tenderness from the surgery. And sometimes people even do have tenderness or soreness for 6 to 12 months after a carpal tunnel release. But by about a month, we're usually ready to let people start going back to doing everything they want to do.
That's good. That seems like an awkward month, though.
a little bit awkward. And yeah, sometimes people ask about, having both their carpal tunnel releases done. And I don't know. I would say I rarely do it. Most people need to have a reasonably good hand to do whatever they need to do while one's recovering. And while it may sound great to just get them both done at once, it does make things like toileting and other things much more difficult.
I was just going to say, you got to go to the bathroom.
Yes. Yeah. Yeah. And you can't go back once you've had it done. So, yeah.
Ugh. So another question I got, stepping away from the carpal tunnel conversation, is how do I protect my hands / wrist from being on my phone all the time?
So, we've really struggled with every new piece of technology. We've really struggled with what does it really impact? And people like to blame sort of the latest technology for whether it's carpal tunnel syndrome or other issues. But there's certainly, and I'm guilty of it sometimes as well, times where you're really playing on your phone for quite a long time. And nerves, like we talked about before, for instance, one of the nerves in your elbow can get irritated if it's being bent all the time, if you can imagine holding your phone. So, things where if you're really going to be on the phone for quite a while, making sure, you take a few minutes here and stretch out your elbow and stretch out your wrist and reposition or switch hands is probably the easiest way to deal with it. Boy, if your hands are really getting sore from holding the phone too much, it probably is time to sort of reevaluate. Maybe I'm looking at the phone too much. And certainly, there are instances where people, get soreness and stiffness from playing games for long periods of time, or I guess swiping through their Instagram feeds for long periods of time. But other than just, I think every few minutes adjusting position or switching hands, it's probably the easiest way to try to avoid any of those issues.
Yeah, I would say like the issue I had was I just had like a really large phone. And so I would hold it in my left hand and kind of let it rest on my pinky finger, like the bottom of it, or my ring finger. So holding it, it would just make that hurt. But I'm but I'm holding it in a stupid way. So I'm that's on me. That's not on the phone. I'm holding this huge awkward phone and letting it sit in my hand a weird way. So for me, the solution for me was just get a pop socket. So I'm well, maybe I can just hold it differently. It's not like I was on my phone for 12 hours a day, but I'm holding this large object in an awkward way. And it's I just felt like that worked for me. So I think it's as a person living through that, it's just don't hold your phone in stupid ways. I guess sometimes just when you hold it over your face in your bed and you drop it on your face so much of maybe you should lay on your side or something.
No, but I think, your point about the phones have, in general gotten larger, which it is. My phone's a little smaller because I think it's easier for me to hold in the palm of my hand and I can slip it in my pocket. But some of them have gotten very large. It gets awkward to hold on to the things. But I think a pop socket is an absolutely reasonable way of doing it. Or, people prop it up, let's say on their desk or something on a little stand. I think you're right. I think the larger phones have become, the more awkward they've become to hold for a lot of folks. And absolutely.
Someone else asked, what are some solutions for tendinitis?
Yeah, so tendinitis truly is inflammation of the tendons, and we commonly see that with activity, right? So most of that's activity driven, whether you're sort of the weekend warrior type and you're out playing soccer and then your Achilles tendon is sore, or we see tendinitis in the hands too from aggressive gardening for long periods of time over the weekend, let's say, and it really. The way we treat it in the hands is the way we treat it elsewhere in the body. It's things like rest and ice and anti-inflammatories like ibuprofen or Aleve. People sometimes can't take those things and they take Tylenol, which can be helpful for the pain, but Tylenol doesn't have any anti-inflammatory properties to it. So rest, ice, anti-inflammatories. Sometimes people feel like a brace or a compressive sleeve can be helpful as well. Most of the time, people just take it easy, lay off it. Things will settle down.
Yeah. Fun fact, I got tendinitis when I was in high school and college from working at Subway from cutting the bread so much. And I had to get a brace for that. And I was I'm 17. How broken is my body already? From cutting bread at Subway. What a lame problem.
Well, we see it as well. There's a specific tendinitis on the thumb side of the wrist where people get it. We see a lot in new parents who are lifting, kids up out of the cribs, which sounds silly and mundane, but repetitive, like cutting Subway sandwiches.
Yeah.
But that it's largely activity driven, where you're doing something a bunch of times. And yeah, our bodies are made to do things repetitively, but there's a point at which, things get irritated and inflamed. So, yep, I'd buy it.
And then somebody asked, how do I know if I have rheumatoid arthritis?
Yeah. So, that's sometimes a really tough diagnosis to make. And sometimes that can be something that's super, super duper clear. So obviously anybody who has a family history of things like that is more at risk of having things like rheumatoid arthritis. And there's a whole group of rheumatologic problems, and that just means sort of autoimmune. So that's our body sort of attacking its own joints. Rheumatoid arthritis being one of those, but things like lupus or psoriatic arthritis, those are all things, same sort of thing. They cause inflammation in the joints, and the joint inflammation actually causes the arthritis. So oftentimes those folks have symptoms that are not specifically localized to just the hand, but they say, boy, I've had my knees are killing me, my hips are killing me, my ankles hurt. And sometimes there's an appearance of arthritis, meaning where it is or what joint it is or the appearance of the hands that can clue you into that as well. Part of it is lab work, which can help make the diagnosis, but it's not perfect either, actually, and is sometimes normal in folks with things like that. And there's sometimes an appearance on x-rays or MRIs or other imaging tests that we get that can clue into it as well. And sometimes it's just sort of a hunch. I start thinking about things like that. The most common patient would be a young woman who has a lot of stiffness and swelling in her hands in the morning without any real obvious reason. But those are things that start raising the antenna of like, well, why is somebody who's in their 20s having a lot of stiffness and soreness and swelling in their joints? That's when we start thinking more along the lines of rheumatologic type problems. And to be totally honest, a lot of the times it's not exactly a clear diagnosis, or it's a diagnosis made over time. But we try to get those folks over to see the rheumatologist, who are really the experts in sort of identifying those patterns when we're suspicious for it.
So how would that be any different than just having any other kind of arthritis?
Yeah, so what we mostly a typical arthritis would be osteoarthritis, which is sort of typically age-related wear and tear type of arthritis that is just where the cartilage on the end of the joint just wears away over time. And unfortunately, as we get older, that becomes more and more and more common. But there's probably a lot of things that go into that as well, and it's probably genetics and use and activity and luck. But that's the more typical, that's the most common type of arthritis would be osteoarthritis. Rheumatoid arthritis, or autoimmune types of arthritis, is where our body actually produces inflammation in the joints itself, and then the joint inflammation actually degrades the cartilage. So that's our body causing the degradation of the cartilage. And so that's a different process than just the old regular wear and tear osteoarthritis. The benefit, or not the benefit, one of the good sides about rheumatoid arthritis or things like that is that can actually be treated. And we have much, much better medications these days to treat things like autoimmune or rheumatoid arthritis, where we didn't have years ago. And years ago, people end up with very deformed hands and all sorts of problems. But nowadays, the medications are so good, we're seeing less and less and less and less of that in the office. So rheumatoid or autoimmune types of arthritis can be treated to try to prevent it from developing further. Osteoarthritis, we really don't know any ways to prevent it from getting worse or progressing over time. It sort of has its own natural history, which is unpredictable. But we don't have any medications that we're aware of as of yet, or supplements, or like things like glucosamine chondroitin, which was a really big topic, probably a decade ago, with the hope of preventing arthritis. It turns out that probably didn't have any effect. So from an osteoarthritis standpoint, there's really nothing we know that will necessarily change the natural history of it. So there's nothing you can take to prevent it, let's say.
Bummer. So I have to ask, do you suffer from anything that we have discussed? Because you're doing intricate surgery with your hands and using your hands a lot. Do you feel the pain of some of these things?
I do have a little bit of what's called cubital tunnel syndrome, which is where that ulnar nerve, that funny bone nerve in your elbow, gets irritated. Mine comes and goes. It's not a consistent thing, but especially for long days where my elbows are bent for long periods of time, or I'm leaning on my elbows, it gets really irritated. I don't have any arthritis that I know of yet, at least, but but the nerve stuff, like that, I think about as the only occasional issue I have at the moment that I'm aware of. But all these things, tendonitis, all of these things, super, super duper common. The good news is most of them are entirely treatable. And most people can get back to doing everything they want to do. And when they can't, there are other things like we talked about. There's surgery for these types of things or steroid injections. That's when going to see a doctor is probably the most useful piece, is when things just aren't getting better.
Yeah.
That's really the time to go see someone.
So if you had any piece of advice for anyone to take care of their hands, what would it be?
Keep them away from sharp objects. Table saws, knives.
Oh God.
I think, if think about things that I see a lot in the office and that you would say is hopefully preventable. I mean, there's a lot of people that fall and fractures and things like that. And most of that stuff is not preventable. It's accident sort of stuff. But particularly for folks who, and I see how it happens. You're cooking and you're cutting an avocado, let's say, which was a very popular thing for a while, and the knife slips and you cut yourself. Or we see a lot of injuries from power tools like table saws and things like that. Or we're getting to that time of year with mowing the lawn and things like that, and people, there's a stick underneath their lawnmower and they just think they're just going to snatch it out.
Oh God.
I think especially over the summer, keeping your hands away from sharp things or things that can do damage, or boating or on boat propellers and things like that too. So
what a visual I'm having.
Yeah. But and those things, they're accidents too, don't get me wrong. But I think, especially around the summertime when people are doing a lot of stuff like that, keeping their hands away from sharp things is important.
So is that like a major part of your job? Do you get like called in because somebody stuck their hand in a boat propeller?
The boat propeller thing, less common, thankfully.
Yeah. You know what I'm saying.
but it does, like you said, especially over the summertime, as people are out doing things, there are a lot more things like that. And it just, not that those are more well, it can be more difficult to deal with.
That seems, it's definitely more horrifying than my hands ache.
Yes. Yeah. Well, that's probably true. But it, I don't know. And I guess that same line of thought, contributes to, we see a lot of folks, for instance, like 4x4s or, ATVs and things, lots of accidents with those over the summer as well, where people are rolling things over or falling off them, or, jumping off a curb or things like that. So we do see a lot more sort of trauma-based stuff over the summer. At least in my mind, at least some of that is more preventable than, let's say, carpal tunnel syndrome or arthritis, obviously. But I think,
be careful.
Just think for a second before you reach under the lawnmower.
Oh my God.
But no, I think in general, like most things, it's staying active is important. Keeping the hands moving is important. This sort of the adage of if you rest, you rust. That's certainly true as well.
Yeah.
So I think, anytime that, as long as it's, like you said, as long as it's not hurting you, as long as you're not getting swollen, as long as you're not having a bunch of numbness and tingling, I think staying active is super important.
Okay. Well, great.
Just think before the lawnmower.
Yeah. Well, trigger warning for me,
or...
listeners. I'm about to ask a very triggering question here because I have to know since you brought this up, because I think it's a fear for everybody when you reach into your garbage disposal because like a spoon falls in there or something. How often do you have to see somebody because something happened from doing that?
I have never seen anybody from a disposal.
Oh, thank God.
That I'm aware of. Although I'll be honest, I don't reach in there either. I'm usually sticking something.
I know, it's so scary.
It gives me the creeps. Yeah, it gives me and especially if someone else is in there with you. I don't know if you're cooking and if someone goes to hit, and hits the switch or something. But no, I've seen lots of blender injuries. Ooh. I've never seen a disposal injury though.
A blender, I guess because you're like, oh, that's stuck. Let me push that down, sort of.
Yeah, or the immersion blenders, which I've never used one, but where you sort of you hold it, but you dunk it in and out of the drink. I think you use it mostly for like grinding ice down or things like that too. But immersion blenders is a very common one.
Oh, interesting.
Yeah, and then like I said, the knife things with taking pits out of avocados or or things like that.
I get that. I didn't have to come to the hospital, but I did buy a set of like really sharp knives because my knives like really sucked. And I'm like, ooh, this is so cool. And slice. And I'm like, oh, they're very sharp. I'm like, I hope I don't need stitches. I was fine. But I'm like, oh, right. Yeah. Maybe got a little overexcited there.
Or like, you ever used a mandolin? Do you know what a mandolin is? Like where you like, it looks almost like a shredder, but you slice like cucumbers on it. Let's say, and it makes real thin slices of the cucumber.
Okay.
So you like slide it back and forth, and people take
off I know
the
what you're talking about.
fingers with it.
Yeah. Oh.
Or boy, the kitchen's a dangerous place.
Right? Yeah. Jeez.
All this. So
I'm just gonna wear gloves with everything now in the kitchen.
There you go. And the other relatively common one is people using knives to pry open like frozen hamburgers. So grilling out over the summer, and people get the frozen, and they use a knife, and then it slips in. I see that fairly frequently too, for whatever reason.
Yeah, I'm guilty of doing that before.
Yeah. At least use a butter knife, or not a steak knife, probably.
Or you just stick it in the defrost it in the microwave for a minute so it pops out a little bit easier. I've done that before.
Could do that too.
So
yeah.
Totally stab myself. I don't know. I've not always made the best decisions. So with sharp objects, but I have not reached under a lawnmower. That one does freak me out too. Like even when like it kicks a stick back sometimes, I'm like, like I'll mow with my glasses on because I'm just so afraid this is going to fly into my eye. So I do have like a paranoia about stuff like that. Like the garbage disposal, which I'm glad that you haven't seen that one because I feel like everyone's afraid of that.
I usually get the wooden spoon out for that and try to, free it up or take it out with a wooden spoon. Yeah.
Well, what a good place to wrap up this conversation.
That's right. Fantastic. Scared of all the kitchen appliances, right? Everybody and all the lawn work. It's my excuse for not doing it. Yeah.
Exactly. Well, there you go. Somebody else can do it now.
That's right. Yeah.
So if somebody does have like they're feeling that they're listening to this minus these trauma things of hurting themselves, but they're feeling, oh, I might have been dealing for a while. I should probably go and see a doctor. Maybe this is something I need to get checked out. What's the process? Like, do they just come see you? Do they just call Christ Hospital? Like, how would that work?
Yeah, I'd say the vast majority of folks are either self-referred, meaning they just say, boy, my hand's hurt and I'm going to go see a hand doctor. A lot of folks who see through their primary care doctors as well. And oftentimes their primary care can treat some of the easy basic stuff. But they certainly can just give the hospital a call, give the office a call. Our phone number is 513-221-5500. But they can also get to it through the Christ Hospital webpage, and we have some online scheduling and things like that too. And that's a nice portal for all things orthopedic at Christ. So I know a lot of people, but a few clicks away and scheduling an appointment, whatever works, whether it's call-in or through the online is a great way to get in touch with us.
Awesome. Well, Dr. Noah Shaftel, thank you so much for joining me. I learn so much every time I talk to you, so I really appreciate it.
Thanks a lot.
AmandaValentineBites.com